Why we should think or consider CK Birla Hospital, Gurgaon? I'm going to tell you, you should be thinking about us before considering any joint replacement which is to be done with robotic surgeries. Before going into any detail, I'm going to tell you that I have been trained into multiple centers in India as well as my training is from Germany. We have used as a team a lot of different robots as well as different navigation techniques for joint replacement and joint preservation surgeries. My experience is almost 20 years in robotic surgeries as well as joint replacement surgeries. So now I'm going to tell you why we should think about CK Birla Hospital, Gurgaon. Not only because I am working here, at least a lot of different specialities are also available in our hospital in orthopedics along with the robotic surgeries. Why we should consider doing a robotic surgery? The best answer is that it is less invasive. That means the size of the scar of the wound is going to be very less. There will be very less tissue handling from our side. We can just go through a small incision, which is called minimally invasive surgery, and we can go inside the joint with a very small scar, and we can replace the part which are damaged only. We can leave aside all the bone as well as the ligaments inside the joints. Now, when we don't touch any of the soft tissue or we do not remove a lot of soft tissue, synovium, or we do not increase the size of scar, the amount of blood loss is going to be negligible, which means you will not need a blood transfusion after any joint replacement. Either it is a hip replacement, either it is knee replacement, one side replacement, or both sides done together. So it is a blood preservation surgery or blood preserving surgery where you will not need any sort of any blood component. Next is that because we are doing less invasive thing, you will be able to walk with a walker or a stick within the same day. Means in the morning if you have operated, in the evening you can stand and walk if you have done one side surgery, both side surgery, hip or knee replacement surgeries. Second, there will be no need of ICU stay. Second day of the surgery, you can walk comfortably inside your room. You can walk with a walker or a stick, and day after that, means second day of the surgery, you can go back to your hotel or you can go back to your home. Because of robotic surgeries, the precision is increasing, the amount of load is reducing, and the patients are even able to travel back to their countries within 5 to 10 days of knee or hip replacement, which was almost never known in any part of the world. So now it is possible. You can come from other country, you can get your surgery done within 5 to 10 days, you can take a flight back to your country, and you can start doing all your activities within 15 days of your surgery. Again, what are the important things you should think about before getting a robotic surgery done? Which is the robot we are using? We are using Zimmer Biomet Rosa robot. Along with, we are using which implant? We are using Persona implant, which is a personalized knee. Personalized knee means it has a lot of customization according to the patient. There is a different implant for females, there is a different implant for the males. There are a lot of sizes in between which can play around and give you best comfort after the surgery. Along with this, the best part is this is an US FDA approved implant as well as robot. So it is completely safe for your knee as well as your joint as well as your body. It has been certified by the US FDA. Apart from it, the best part is that it is definitely economical as compared to any robot in the world. So it is super economical and you can just get all the benefits of robotic surgeries with a cost of almost conventional surgeries. What else for the future? You have to understand, because we are doing it with a robot, the alignment is perfect. So this perfect alignment is going to keep the implant intact for longer years. Usual implant life or longevity is somewhere around 20 to 25, 30 years. Now with robotic surgeries, I think it is going to be more than 30, 35 years. So understand, it is also increasing the longevity, so younger patients can also go for joint replacement surgeries. Not only joint replacement conventional surgery implants, we can use now ligament sparing implants in this type of robots where we can preserve all the ligaments of the patient. So if you are thinking about joint replacement surgeries, you should consider CK Birla Hospital, Gurgaon in India. and you should consider us with one of the best robot in the world and best results, which I am going to show you in this video. You will be able to achieve all the things with this robot. Thanks for watching this video.